The first thing I want to talk, the subject, the title universal healthcare is a very interesting subject. What disturbed me the most is how WHO or the ILO refer to healthcare or to social protection as a human right. Because technically speaking, whether social security or healthcare, somebody has to pay for it. What is interesting is the wording, and this is where lawyers are very, very good. When they wrote in the United Nations about human right, about healthcare, they said you cannot discriminate. So I cannot, as a government, give one sector of my population something and another sector something else. This is where a human right, this against discrimination, against race, against income, against gender, against all kind of health position. But when our country is planning a universal health care, they should start by saying, what can we afford at this stage? What can we afford at this stage? And what is the implication of the economy? We all know, as we are all in this room, is in the private sector. The private sector, like always, a piece of the cake. This is when they had mandatory insurance, motor insurance. The private sector is very happy because they can sell insurance quickly. So the private sector is waiting for mandatory healthcare. And we've seen mandatory healthcare in many countries. And one of the countries that has been very successful and has been a showcase in many countries in the region is Rwanda. Rwanda, they had mandatory healthcare, and within 10 years or a little bit less, they were able to reach almost 90%, 100% universal healthcare. But people don't realize that. What happened in the process? They said, okay, we have 3 sectors of the country is. The first sector is the formal sector. And the formal sector, what we define formality, it means people that pay tax.